Welcome everyone. My name is Linda Weisenberger with Aurora University, Nursing 6180, Theoretical Foundations for Nursing Education. The topic of the lesson today is focused on health literacy and its importance in daily practice for nurses. For starters, I would like to present an example of how a person of low or limited literacy and/or health literacy may view health information as it's being presented to them. Our first example, as you can clearly see, is not written in English. It is written in German. So unless you are fluent in German, you are very unlikely to be able to read this, let alone comprehend it. You probably can pick out words such as diabetes, insulin, but other than that, pretty much you're not going to be able to understand it, unless, of course, you are fluent in German. So the second example is the same definition. It is written in English, but it uses some fairly large words and some words that could be considered as medical jargon, such as a metabolic disorder or insulin resistance. These are words that you, as health professionals, probably can understand and interpret what's being said, but as the common consumer reads it, they may be able to read the words, but are they really able to comprehend what's being told to them? So our third example, although it's a very simplistic definition of diabetes, is probably much more likely to be understood by the common consumer. It uses simple words, simple sentence structure, and it provides exactly what they need to know. Okay, so our three examples are just one way of thinking about literacy and health literacy. So let's back up for a minute and discuss literacy in the U.S. in general terms. First, literacy is defined as a person's ability to read, write, speak, and compute and solve simple math problems at levels necessary to function on the job and in society, to achieve one's goals, and develop knowledge and potential. The term illiteracy means being unable to read or write. Something to keep in mind here. A person with limited or low literate skills is not illiterate. They do not necessarily have a low IQ or are incapable of learning. It simply means that they have limited proficiencies in the areas of reading, writing, speaking, and numeracy. This could entail a learning disorder. It could entail lack of exposure, or perhaps the individual speaks another language, is not proficient in English. In 2003, the National Assessment of Adult Literacy identified that only 13% of Americans fell into the proficient category of literacy. Furthermore, 43%, or 93 million individuals, fell into the basic and less than basic categories for literacy. Think about that for a minute. How will that impact you in your daily practice? Think of all the paperwork and all the instructions that are given every day in the healthcare world. Can people even read it? Are they even able to comprehend it? Health literacy, simply defined, is the ability to understand and synthesize health information. It is recognized by the Institute of Medicine as an integral component of high-quality healthcare. Based on the NAAL report, it is estimated that 36% of all adults in the U.S. have limited health literacy. The prevalence increases to around 50% for those who come from a low-income background. In pediatric populations, it is estimated that 1 in 3 caregivers or parents have limited or marginal literacy skills, meaning that they have difficulty using complex text to accomplish everyday tasks, and they lack the skills necessary for full participation in healthcare settings. So again, what does this mean for nursing? It means approximately 80 million Americans lack the necessary skills to understand their own health information and participate in the management of their own personal care. For you personally, that means almost 50% of the patients you care for in your clinical experiences will have less than proficient literacy skills and will unlikely be able to fully decipher most of the medical information that you provide to them. This week's discussion forum is going to be a little different than what we've done in the past. I have divided you up into 4 different groups. Each group will be required to initiate a Google Doc for sharing of information between yourselves and with me. The goal will be to create a plan of how to address the specific literacy needs of a patient that you will select. If you are having difficulties with Google Docs or not familiar with it, the information is listed in the syllabus as to how to do this, or you can certainly contact me for assistance. There will be 2 different case studies. Your group will just need to select one and follow the instructions listed in the syllabus for developing and presenting your case study to the class. Again, you will not be creating learning materials for the patient, but you will be creating a plan as how you will identify and address the specific health literacy concerns for this particular individual. So the first case study is a 49-year-old bilingual Hispanic male born in Mexico. He has recently been diagnosed with type 2 diabetes and will require basic instruction about the disease, medications, and recommended lifestyle changes. The second case study is an 80-year-old white female born in the U.S. She was recently diagnosed with congestive heart failure and will require basic instruction about the disease, medications, and recommended lifestyle changes. As I progress through the information in the lecture portion of this presentation, I want you to be thinking about these case studies and start processing how will you address their needs and how are you going to assess what those needs are. After you have finished viewing this video, please be in contact with your group as soon as possible, as the first part of this project is already due Tuesday at 11:59 p.m. Health literacy and its impact on nursing daily practice. The learning outcomes of this presentation are that nursing students are going to have an understanding of what health literacy is and how it impacts health outcomes of our patients. Nursing students should be able to describe the role that nursing plays in identifying low health literacy and be able to identify appropriate teaching methods for low literate learners. Student objectives for this presentation is students should be able to define health literacy, risk factors, groups that are at risk for low health literacy, be able to describe the impact of low health literacy on the healthcare system. Students should also be able to describe methods of evaluation of health literacy in materials and individuals. They should also be able to describe appropriate teaching methods for low literate learners. So, what exactly is health literacy? The U.S. Department of Health and Human Services, Health Resources and Service Administration defines health literacy as the degree to which individuals can obtain, process, and understand the basic health information and services that they need to make appropriate health decisions. Essentially, can the patient read and comprehend health information well enough to function successfully in the healthcare environment and use health information to make good decisions about their care? Health literacy also includes numeracy skills, which, for example, is the ability to calculate things such as blood glucose levels and insulin, medications, understanding nutrition labels. Another thing to think about is having the ability to choose between health plans, understanding deductibles, premiums, and copays. Individuals with low health literacy are often misinformed about the body, nature, and the different causes of disease. This may limit their ability to understand relationships between lifestyle and health outcomes. Factors that affect health literacy include the ability of the layperson to communicate information to healthcare providers, as well as the ability of professionals to tailor information to the level of the patient. Providing health information in medicalese limits the layperson's understanding, and if the layperson does not understand what information is needed or what the questions mean, they're not likely to provide pertinent information for diagnosis and treatment. Previous knowledge of health topics also affects health literacy. If the layperson and the health professional both have a solid understanding of the body and how it functions, obviously it's going to be a lot easier to explain and understand the current health situation. However, if that knowledge base is not there, or if the previous information is incorrect or poorly understood, it inhibits the ability of the learner to understand new health information. Health literacy can be significantly impacted by cultural health practices and beliefs. Culture is not just about the language the individual speaks. It's not sufficient to just provide the health information in their language. You have to remember, it includes things such as beliefs about healing, medicine, and alternative therapies. It also includes beliefs at the community level as well as the family level. Short hospital stays, limited time with nurses, decreased reimbursement, increased technology, and how complex it is, and access to services all contribute to individuals' ability to understand the health information being provided. Environment, health status, support systems all impact health literacy as well. So, who needs health literacy skills? Simply, anyone who is seeking information and services in the health environment needs health literacy skills. Health information and services is not just about seeking help when someone is sick or there's an emergency. It includes the whole process of finding the correct type of provider, or a provider who accepts their insurance, someone who's accessible to them. It includes filling out complex forms and understanding health rights. Health literacy is about being able to communicate personal needs and sharing information like one's own health history or family health history. Knowledgeable individuals feel more empowered to be able to verbalize their personal preferences and wishes. In order for individuals to be able to utilize health information, they need to be able to understand what it means and why it is useful in their particular situation. If an individual is not able to personalize information, it is very unlikely that they will follow the instruction. Most likely, they won't even understand that it pertains to them. Health literacy is being able to understand the choices being presented, the consequences of following the instructions or not following them, and knowing when the information that has been given to them should be applied. Having this knowledge allows individuals to engage in self-care and chronic disease management successfully. There is a lot of health information available to individuals. Sources include their family. There's a lot of health books out there and the internet. An important part of ensuring good health outcomes includes having the ability to sort through that information and determine what's going to work best for them. Why exactly is health literacy important? Basically, limited health literacy leads to poor health outcomes. Individuals with limited health literacy are less capable for caring for themselves. Mistakes are easily made with medications, calculating doses, or perhaps the importance of the medication was not understood, or simply the individual decides not to take it because they don't think it's important, or maybe they can't afford it, or they just simply don't believe that it's something that they should need to take. All of these things lead to more emergency room visits and then possibly subsequent admission to the hospital. Serious complications can occur when an individual does not clearly understand pertinent health information. This type of information isn't just limited to medications. We're also talking about information that's provided to them after perhaps a surgery, wound care, medication for pain control. All these things, they all combined are part of that health literacy that is so important for people. Vernon, Trujillo, Rosenbaum, and De Bono indicate that the cost of low health literacy is possibly as high as $1 to $3 trillion per year. In Kavanaugh, as cited in Scott, states low health literacy leads to greater risk of death. For each 10-point decrease in the health literacy screening score, there was a 16% higher risk of death in a study that they conducted. Low literacy greatly affects motivation and compliance levels. And oftentimes we as health professionals view non-compliance as patients that are choosing not to do things, or they're just being stubborn, or they're just not wanting to understand. But in reality, many times it's they're unable to comply, or they just simply do not understand. Clearly, if they don't understand the health information, it cannot be synthesized or translated into healthy behaviors, and ultimately can lead to a decline in health for that individual. This slide contains a lot of information. Health literacy and literacy in general has become a national initiative for many different entities, and there are a lot of different sources that have weighed in on this topic. So I'm just going to try to hit some of the highlights. Our text, The Nurse as Educator, definitely goes into more detail. There is a lot of information out there on websites, health literacy on the Centers for Communicable Diseases, as well as Healthy People 2020. Many resources that are available that provide recommendations for how to address health literacy in our patients. Starting with the Joint Commission, their standard states that the patient and or significant other must be provided with education that enhances the knowledge, skills, and behaviors needed to fully benefit from healthcare interventions. This standard is linking health literacy to safety and quality care. The National Action Plan to Improve Health Literacy and Healthy People 2020 call for health literacy education for nurses and other health professionals. Unfortunately, there are no established guidelines about what exactly should be included in the curriculum, and there's limited literature about what topics are being taught at the undergraduate level. Nursing needs to support research on the topic of health literacy and support the use of developmentally appropriate and evidence-based materials. Curriculum for healthcare providers needs to be developed that explains health literacy and guidelines for how to use it throughout the entire nursing school experience. Strategies for the NAP, or the National Action Plan to Improve Health Literacy, goals include developing and disseminating information that is accurate, accessible, and actionable, including such things as comfortable environments, decreasing the use of medical jargon, reinforcement with pictures and drawings, and keeping materials to a 5th grade reading level. Something we haven't discussed in the past is that it is estimated that the average American reads at an 8th grade reading level. That means all materials should be less than 8th grade, and much of the literature even suggests less than 6th grade level to be understandable. These materials need to use plain language, and any written language needs to use simple words and short sentences. If you go back to the example that I had shown you in my introduction, think about the difference between the second and the third examples, and how much easier the average person is going to understand that third example that just very briefly, very succinctly told them exactly what they needed to know. Things that nurses can do, or healthcare professionals in general, is promoting changes in the healthcare system that encourages colleges to incorporate health literacy instruction in all classes, encouraging the use of the teach-back method to ensure patients are understanding, and use the smallest amount of information needed to accomplish assigned goals. Again, going back to that example of keeping it as simple as possible, providing as little as information that is needed so that they can understand, and not be overwhelmed with the amount of information that's being provided to them. Outside things that we can do is to begin to build partnerships with local entities that focus on learning, like schools and libraries and education centers. Going back to the dissemination of information, it doesn't always need to be provided in the hospital or clinic setting. Learning can also take place in outside places. There are many local entities who support individuals with low literacy. They certainly welcome health professional referrals, but they could also use health professionals to come in and volunteer and interact with those people, perhaps even conduct some health teaching. What better way to know and understand the resources than to be part of it? Joining with these local bodies as they seek to educate state and federal policymakers about the needs of their clients is also another way to open up the conversation about literacy and trying to help people understand the need for education for these people. Providing information in the patient's own language and utilizing translation services or bilingual providers is also important. Improving health literacy in the U.S. is part of many different objectives for the Healthy People 2020, including ensuring appropriate information is provided in a variety of ways, such as the appropriate use of technology and community outreach programs. And I included the link there for Healthy 2020 because you can go directly to their website and see additional details. So Healthy People 2020 didn't have a specific goal that addressed health literacy, but it is in part of many other goals. It's part of it and included in part of it throughout the entire objectives and goals. Health literacy is directly mentioned in 4 sections of the Affordable Care Act. These provisions include dissemination of research regarding health care quality measures, enhancing shared decision-making strategies, proposed advocacy regarding changes in medication labeling, and workforce development inclusive of health literacy strategies. The legislative language alludes to health literacy in several key areas, but it is mentioned within a consultative model only, without any regulatory mandates or associated financial provisions. The workforce development areas were allocated $125 million in the form of loans, grants, and loan repayments to recruit physicians and physician assistants into primary care, and the legislative language does highlight training in cultural competence and health literacy, but the direct money allocation is not health literacy specific. So let's discuss who is at risk for low health literacy. I really liked in our text, Nurses Educator, how the author said, healthcare providers need to develop a universal precaution when working with patients. We need to be aware of the risk groups, but we also need to remember that everyone is going to be at different levels of understanding, and we need to be sensitive to those differences. Just because they may or may not be in one of these considered at-risk groups does not necessarily mean that they will or will not have low health literacy. So let's start with the elderly. The overall decline in physical and mental ability associated with aging, such as things like hearing and vision, or limited daily activities that may contribute to cognitive decline, living on low incomes are all factors that cause elderly individuals to be at a greater risk. By 2030, it is estimated 71.5 million adults aged 65 years of age or older will be living in the U.S. The National Assessment of Adult Literacy indicated 71% of adults older than 60 had difficulty with print materials. 80% had difficulty using forms or charts, and 68% had difficulty interpreting numbers and doing calculations. 51% of adults aged 65 to 75 were at or below basic levels of health literacy, and once they went to age over 75, that number rose to 70%. I mean, when you think about that, that really speaks to how we need to now start addressing these issues, because it is only going to become a more important issue as we continue on. Racial and ethnic minorities. Compared to whites, racial and ethnic minorities have higher rates of morbidity and mortality and lower levels of health literacy. According to the National Assessment of Adult Literacy, 28% of whites were at or below basic levels of health literacy, compared to 57% blacks, 65% Hispanic, and 34% other minority groups. The underlying assumption is that the lower health literacy for ethnic minority is due to lower socioeconomic status, lower educational attainment, employment status, and language barriers. According to the same National Assessment of Adult Literacy, 76% of individuals with less than a high school degree are at or below a basic level of health literacy, compared to 12% of individuals who have a bachelor's degree or higher. Higher levels of educational attainment definitely translate into better overall health outcomes and higher levels of health literacy. According to the U.S. Census Bureau, over 40 million individuals live below the poverty line, and almost half of those individuals are considered low literacy. So for the example that I had found is that an increase of approximately $5,000 in personal income is associated with a significant increase in health literacy levels. Not only are poverty and low income a significant risk for poor health outcomes, but the experience of a severe chronic illness or disability can also reduce your overall earning potential and therefore reduce possibly your health literacy levels. And this part I found kind of interesting. Hispanics who only speak Spanish compared to Hispanics who speak English and Spanish experience greater disparities in use of healthcare systems and health outcomes. Nativity has a protective influence, though, even for the most disadvantaged racial groups. While both native-born and foreign-born Hispanics had lower health literacy levels, foreign-born Hispanics had significantly lower scores than even their native-born counterparts. Persons who are ill have diminished capacity to understand what is being taught, and that could just be due to how they're feeling that day, how their medications could be affecting their cognitive abilities, or just their overall capacity to function. And this is one that, although it wasn't in the research, it is something that I have personally observed from my children. College-age students, I would put them at a risk for low health literacy. And why would I to do that? I guess an example I would use is college-age students. They've just left home. Prior to that, their parents probably made their healthcare appointments, maybe attended their appointments, and kind of translated the information from the doctor to them. Now, think of if a student was identified as having type 1 diabetes and it's a new diagnosis and they're away at college. How are they going to learn to navigate the healthcare system? And they don't have a lot of prior knowledge, so therefore they need to learn these things and have information given to them that's at their level. So there are tests out there that measure health literacy. And again, our text, The Nurse's Educator, goes into greater detail about these tests, so I just want to give you some highlights. This is not something that at this point in time we would expect that you would be able to administer all of these tests, but you need to be aware of them and aware of their uses. First of all, the Wide Range Achievement Test, or the WRAT, is a word recognition screening tool that assesses a learner's ability to recognize and pronounce a list of words. It takes about 5 minutes to administer and provides a picture of the client's basic literacy level. It does not, however, measure vocabulary and comprehension of text material. The Rapid Estimate of Adult Literacy in Medicine measures the patient's ability to read medical and health-related vocabulary. It's a lot quicker to use, simpler to score, and typically pretty well received by patients. The score is converted into an approximate grade level, which causes it to be a little less precise than the WRAT, but it is validated and considered very reliable. The Test of Functional Health Literacy in Adults measures patients' health literacy skills using hospital materials, such as prescription labels, appointment slips, or like informed consent documents. It is considered reliable and valid, but it is longer and takes about 20 minutes. It could be very difficult for a patient or someone who is, just becoming introduced into the healthcare system to want to participate in. The newest vital sign is developed to identify those at risk for low literacy. It is quick, 3 minutes only, easy and inexpensive to administer. An ice cream nutrition label is used to ask questions of the patient. The responses given are assigned a number. The overall score received is classified into one of 3 categories: likelihood of limited literacy, possibility of limited literacy, and adequate literacy. The eHealth Literacy Scale is used to determine a patient's ability to find and navigate electronic health information. There's only 8 items, and it measures patients' comfort level and perceived ability to address their health problems by finding electronic information. The literacy assessment for diabetes is very specific. It is just for patients with diabetes. It is a reading skills test that can be administered in 3 minutes or less. 3 word lists are given, and they're in ascending order of difficulty. Once they've maxed out, then the test is ended. And it provides a grade-leveled reading score. The suitability assessment of materials rapidly and systematically assesses the suitability of instructional materials for a certain population of learners. It can be used with print material, illustrations, videotaped and audiotaped instructions. It is able to identify specific deficiencies in instructional materials that reduce their suitability, and then this, by addressing specifically what is wrong, it allows for adjustments to be made to the materials. Again, I'm just going to briefly go over these assessments. Our text gives a much more detailed description of them, and obviously more information could be found on the internet. You are not expected to be proficient in them, just be aware of them and their uses. The Fleisch-Kincaid scale is an objective measurement of readability of materials between 5th grade and college levels. It has been used for more than 50 years. Reading E-scores are established by assessing the average sentence length and average word length. The FOG index determines readability from 4th grade to the college level. It is based on average sentence length and their percentage of multisyllabic words in a 100-word sample. It is simple because it is it's just 100 words. It's a very short sample. The Frye readability graph is a test of readability from 1st grade all the way to college and is based on a number of syllables, the number of sentences in 3 100-word selections. So it's a little more detailed than the FOG, but it would take longer to conduct. The SMOG, S-M-O-G formula, simple, is fast and valid. It measures from 4th grade to college levels. It's based on a number of polysyllabic words within a set number of sentences. And it is accurate to within 1.5 grades. And is considered one of the more popular ones because it is accurate, simple, and quick to use. Now, if you really want to go high-tech, there is software called computerized readability software, and it can apply many of these formulas and identify specific words that may be problematic. It is fast, easy, and reliable, and it eliminates the possibility of human error. One of the biggest advantages of it is being able to apply multiple formulas. The CLOSE procedure is used to assess the understanding of health information, and it's best used when assessing the appropriateness of several texts of the same content for a specific audience. The reader is given a text and has every 5th word deleted. The reader is then expected to fill in the blanks. So they'll read through the passage, then they're given a text, and every 5th word is deleted, and they want them to put those words in there. The number of correct answers determines how easy the material was to comprehend. The one drawback to this one is that the reader has to be at a 6th grade level or higher. The listening tests assist in determining what a low literate person understands and remembers when listening to oral instructions. So just as it describes, everything is read to the learner and the questions are asked orally. Once you've established an approximate literacy level of your patient and you've reviewed the materials and you feel very confident that they're appropriate, there are some additional things to think about as you prepare the information you're planning to share. Assess prior knowledge. Now, this goes back to health literacy. Earlier in this discussion, I had discussed how sometimes people have a solid understanding of health and information, and you need to tailor your presentation and your style of presentation to that. So you shouldn't be providing information that they already have and understand. But if the information that they have is incorrect, you're going to have to find ways to address that tactfully in how to show them that the new information can be synthesized into what they already know. So making sure that you are meeting them on their level. Equally as important to ensuring the materials are written in plain language is to make sure that you are going to speak in plain language. A lot of times as we're talking, we start kind of slipping into our medical jargon and we don't even realize that we're doing it. So making sure that we're not using medical terms, that we are speaking in common everyday terms. Keep the message focused. 1 to 3 key messages is about all that a patient can comprehend in one setting. Making sure that information promotes action rather than detailed explanations and a lot of facts and figures. You start to lose people when you give them too much information. Focus on what behavior do they need to do to be successful. Making sure that there's not a lot of unnecessary detail and that you're starting at the basic. You should be building on it each time that you meet with that individual. Keep the key messages on behavior, as I said before, making sure what do they need to do. This helps motivate them and empowers them because it puts it in their ballpark. They are the ones that they have to do this, and if they do this, they should be successful. Having in your mind, how are you going to evaluate the learner? You may have this beautiful plan already, but maybe the learner isn't able to, say, teach back or explain things in their own words. So how are you going to evaluate what they've learned? Have a couple of things in your mind ahead of time and be prepared to follow through. Implementation. There was an article by Bowen, and our text Nurses Educator gives a lot of very good information. So I'm just going to give you a few highlights. Make sure that you're in a comfortable environment, that you're using a caring tone of voice, and that your attitude is one that says, I'm here to help you and I'm here just for you. Your body language should be comfortable. You should be making good eye contact. Again, I'm reiterating that you should be using plain language, avoiding medical jargon. Be sensitive to cultural aspects at this time. There may be certain words that you use that have different meanings in their culture. So it's something that you should be prepared to assess. People with low health literacy can be embarrassed and they can be ashamed of it. So when you're using questions, make sure that they're non-shaming and that they're open-ended, and be sensitive to that embarrassment and shame. Use simple but developmentally appropriate words. For example, just because somebody has low health literacy levels doesn't mean that they need to be talked to or spoken to as if they're a child. They should be respected as adults, and that we're just using simpler terms and frequently checking to make sure that they are understanding the terms that we are using. Avoid, as I said before, use open-ended questions. Avoid asking questions that can be answered with a simple yes or no. This does not provide for communication between the two of you. Emphasizing that the responsibility to explain clearly is on you, the provider. Something that I like to say to my patients is, I'm not satisfied until you're satisfied. Until you can tell me that you've understood everything that I've said, my job is not done. Using reader-friendly print materials that support learning, kind of going back to the elderly. If they're having difficulty seeing things, you don't want to present them with information that is in small print. The materials should be easy to read, have good size fonts on them, and if you're using graphs and tables, they need to be large and they need to be simple and clearly labeled. You should be using a variety of tools. Technology is extremely useful if the learner's comfortable using it. That's another assessment that you need to kind of make sure of, is that that person is comfortable using technology. Some of your elderly patients, it's going to be hit or miss. They may or may not want to use technology. And then those that do say that they can use technology, make sure that they're able to use it appropriately and that they can use it to its full extent. You should not be relying solely on technology or written materials. There should be a combination of many things. Be cautious of pictures. Some studies have shown that historically pictures used for medical information are not well understood or recognizable. So make sure that as you're going through the teaching process, that if you're using the pictures, make sure that they understand what the pictures are about and what they're trying to show. An easy way to do that is have the patient explain the picture in his or her own words. Speak slowly, unhurried, and frequently stop to see if the learner is understanding. You should stop after about 20 minutes because anything longer than that tends to be forgotten because it overloads the learner. Evaluation. I spoke to this briefly before. One of the easiest techniques is to have the learner reteach the material to you in their own words. Again, it may take them a little longer. It may be a little harder for them to articulate, so you need to provide a quiet, unhurried environment, be encouraging and understanding. Repeat back to them what they've said to you. If they've missed some important or impertinent information, repeat that back to them. Don't make them feel silly or make them feel as if they missed a big piece, but kind of help incorporate that. Keep it as an open conversation. Teach and reteach as many times as necessary. Your job is not done until they can say with confidence that they are able to perform the tasks or reiterate the information that you're trying to provide for them. If the information provided requires a skill, such as changing an ostomy bag, you could have them provide you with a return demonstration. Again, be prepared. This is something new. This is not something that they probably have any experience with, so be prepared. It may take several times to develop the necessary skills. And again, reteaching should be done in an unhurried, in a non-judgmental way. Provide adequate time and provide encouragement. Maybe if you sense a lot of frustration, you may need to say, you know what, we're only going to do one piece of this. Maybe we are just going to cut out the ostomy bag and you're going to trim the edges and things like that. And that's just the one test that we're going to work on at this point in time. And then provide them with the opportunity to give feedback to you about the materials and the education process. Including an evaluation of the educator. This information can be used by you to constantly be increasing the efficiency and the efficacy of your methods of instruction and can give you valuable information and insight into the types of learners that you are working with. I've provided you with a fairly extensive list of references Here, I want to draw your attention to obviously our text, Nurse as Educator. The Centers for Disease Control offers a lot of information and special groups for health literacy. Their website is just a wealth of information. Healthypeople.gov, as I had explained earlier, is also a good resource. And again, information from the United Census Bureau, the Department of Health and Human Services has quite a bit of information on health literacy and the basic facts that we should need. So I've also here included a very brief evaluation of learning goals. I would appreciate it if it is in your syllabus and you can print out a copy of it and submit it to me. I would appreciate it. And I certainly value all of your comments and suggestions. I want to make sure that you can understand what health literacy is, how important it is, and that you have some skills and some tools that you could take with you into your clinical experiences. Thank you for listening, and I hope that you've enjoyed this presentation and that you have found it beneficial in your future practice. The impact of low health literacy on the healthcare system is astronomical. Being able to learn, retain, and apply health information is greatly affected by health literacy and greatly affects patient outcomes. Patient education is primarily conducted by nurses, and yet, according to Kennard, nursing is the discipline that is most lacking in knowledge and awareness about health literacy. Understanding the importance of health literacy and implementing effective strategies to address low literacy is the first step in creating real change for our patients. Okay, so as a group, using Google Docs, I would like you to first provide a summary of the problem, determine what tests you will choose to assess literacy in your chosen patient. Once you've submitted those tests, and again, remember, you don't have to conduct the tests. I just want you to determine which tests you feel will be the most beneficial for your chosen patient. I will then respond to you, and I will provide information to you about your patient that will help you complete the rest of the assignment. Once I've presented you with that additional information, your group will need to determine strategies that address the literacy level of your patient. Please remember to invite me into the Google Docs so that I may view your progress.